So I drew this cartoon just to explain a little to you about how vaccines are made. And we start off here with our live virus. You can see there's some genetic material there, and that is what makes that virus replicate. And these purple dots on the outside are what's known as epitopes. They are also responsible for stimulating an immune reaction from the host. And vaccine manufacturers take this live virus and they manipulate it in a number of different ways in order to make different kinds of vaccines that have different qualities for us to choose from. So there is inactivated or killed virus vaccine where the DNA or RNA from that virus has been completely killed, it's inactivated. Modified live vaccine, the DNA or RNA is still in there, but it's in a modified and severely weakened form. So when we give a modified live vaccine, we are in fact giving an infection with that particular infectious agent, but it is a very much attenuated infection. More recently, there have been purified subunit vaccines where they've been taking these epitopes from live virus and using them to stimulate an immune response that is protective. There's gene-deleted vaccines where they take the genetic material out so that virus can't replicate anymore, but it still has the epitopes on the outside of the virus particle to stimulate an immune response. And then a lot of you will have heard and used live virus vectored vaccines where you're taking another kind of virus that is not pathogenic to the animal that you're interested in this case a dog. Perhaps it's canary pox, for instance. Canary pox can cause an infection in dogs, but it doesn't cause clinical signs. So we combine the canary pox with the DNA or RNA of the virus that we're interested in getting protection from, and we make a live virus vectored vaccine. So this table, it's rather busy, but I'll just hit the take-home messages from it. We've got 3 different columns here: killed vaccine, modified live vaccine, and recombinant vaccines. And each of these have different features that might be used to our advantage in different situations. So the onset of protection in modified live vaccine or recombinant vaccines is much faster than in killed vaccines. So in an animal that does not have maternal immunity to block the vaccine, a single dose of modified live vaccine is an immunising dose. It will be protective. However, if you use a killed vaccine in that same animal, you're going to need 2 doses in order to achieve protection. So that's really going to slow things up. The first dose is a priming dose, and then the second dose is an immunising dose. And you're not getting protection until a week after the second dose. Now, we're talking a few weeks here, maybe 3 to 5 weeks before we get full protection. 3 to 5 weeks is an awful long time in a lot of shelters. So for speed of protection alone, I think most shelters are choosing modified live vaccines. We're also interested in safety, of course, and killed vaccines may be slow, but they are safe. So we do have to watch out for potential problems especially if we use a vaccine by the wrong route with modified live vaccines. I don't know if any of you have ever had problems where a Bordetella bronchoseptica vaccine that is meant for intranasal use has been given subcutaneously. That can cause really bad liver problems in the dogs that are affected, and you've really got to make sure that you use the vaccine exactly as recommended, because if you don't use that exactly as recommended, there can be really quite severe side effects. modified live vaccines can also cause problems in pregnant animals, especially with diseases that can cause neonatal infections such as canine parvovirus and of course feline panleukopenia virus. And this is why we don't recommend, even in a shelter situation, that you start vaccinating before the age of 4 weeks. There can also be a problem with dogs with reactivation of immune-mediated disease that is stimulated by vaccination. Immune-mediated hemolytic anemia can happen associated with vaccination in dogs. That's a rare event, and I think certainly in a shelter population, the risk of actual infection with these infectious agents that are so common in shelters is much higher than the risk of immune-mediated hemolytic anemia. So really the IMHA is a problem for the private practice world much more so than for the shelter world. With the recombinant vaccines, a reversion to virulence is not so much of a problem, but it can be associated with IMHA just the same as modified live vaccinations. As far as maternal antibody interference goes, and that's a big problem in shelters where we're accepting lots of puppies in all the time of unknown vaccination status for both the puppies and for their mothers, it is possible for that to happen with killed vaccine, but it's less likely in dogs that are over that 12-week mark, of course. As long as you give a dog that is over 14 to 16 weeks of age modified live vaccine, you can be pretty sure that there is not going to be any maternal antibody interference. Recombinant vaccines can have some advantages here, especially with canine distemper virus, and some people do choose to use recombinant vaccines in their puppy population for this particular reason. Storage and stability are also very important because we've paid good money, hard-won money, for vaccines, and we want to make sure that we're getting what we paid for. Killed vaccines are pretty tolerant. Yes, we should always follow the manufacturer's instructions, but they are more tolerant than modified live vaccines. We need to make sure that that living organism stays alive because that's the only way it can work for us. And we really do need to use that vaccine, if possible, within an hour of reconstitution. We don't want to get organised for the whole morning and reconstitute all our vaccines for the whole morning, and then 2 or 3 hours later we're still doing the last few puppies. The vaccine's just not going to work properly if we do that, and certainly with modified live vaccines, 2 or 3 hours after it's reconstituted, really you can't expect too much of it. So you've got to keep it refrigerated, and you've got to absolutely observe a time limit after you've reconstituted that vaccine. The cost of vaccines is always a big issue. Recombinant vaccines are modern technology, and they have some advantages that I was telling you about earlier, but they are more expensive than modified live vaccines or killed vaccines. All of these things, the onset of protection, the safety, the stability and maternal antibody interference, they're all part of the equation that we've got to weigh up the pros and cons for our own particular shelter situation, for the dogs that we bring into our shelter. Are we in an endemic area for parvovirus, for instance? Is distemper a real problem in our particular area? Also, are we transferring from endemic areas? All of these things go into the equation. We have to weigh up benefits and risks.